You know, the older that we get, the more problems we seem to have, and one of them is having to deal with joints. Well, this morning we're here at Nexgenesis, and we're going to talk about joint issues. Dr. Greg Bredemeyer, how are you, sir?
Doing pretty good.
Good, good. What is joint rejuvenation?
That's a multifaceted approach where we use the body to heal itself. Mm-hmm. It was designed pretty intelligently, mm-hmm. and if we just put the body in a position to do what it normally does, what it's designed to do, stay out of the way, it can heal itself.
Oh, nice. Mm-hmm. What kind of joint issues do you typically see?
We see really about everything. Neck, backs, almost everybody has back problems if you live long enough. Knees, ankles, wrists, you name it.
Any part of your body that has a joint?
Pretty much, which is about everywhere.
You see those kind of issues. Now, what is the normal downtime for joint surgery?
Oh, yeah, surgery, any surgery, you're looking at a good 6 weeks. And the replacements can be longer, shoulders can be quite problematic, and healing just takes a very long time.
I mean, I know there's probably a period of time that you can't do certain things like, drive or, just even pick up things, simple things that you used to can do.
Right. And sometimes people have more than one procedure at a time, which mm-hmm. really complicates the issue.
Mm-hmm. Now, I mean, as far as doing that, I mean, that's one problem. So is there any kind of downtime from what you do for joints?
We do really not any invasive procedures. There's some skin punctures, there's some soreness, that's about all you're going to have.
Mm-hmm. So you might be just down for, a few days?
A few days.
Yeah?
Yeah, 4 days.
Not like doing surgery.
Definitely not like surgery.
And I mean, and a lot of people, their lives depend on being able to get up and motivate and move around, and you're down for several months, that's going to be a major
mm-hmm.
problem.
Yes, sir.
Now, I mean, is this like pain management?
No, this is definitely not pain management.
Okay.
And in fact, we're getting the body to heal itself as it was designed. Mm-hmm. With pain management, you've pretty much at that point given up with the healing process, and you're just trying to keep the symptoms down. You're just suppressing symptoms, mm-hmm. and we're actually trying to improve your situation.
I mean, it's like with that, you're putting a bandage on something that is never going to really heal.
Right.
For doing something like that. Right. That's. I mean, you have. It is really an interesting alternative to medication and surgeries doing that. Now let's talk to Dr. Lawrence Bourgeois and find out more about what they do here at Nexgenesis. Dr. Bourgeois, it's always a pleasure to come and talk to you. And some great information that Dr. Bredemeyer had to share with everyone.
Absolutely. I mean, no one wants surgery if you have a possibility of avoiding it, right?
Right.
Especially as opposed to those dangerous options that actually can degenerate the joint more, like steroids. They cause more degeneration or arthritis to the joint. They elevate your blood sugar levels. So if you're a diabetic,
I didn't know that.
Oh yeah. So if you're a diabetic, it can be very dangerous for you. On top of that, they limit you to a certain amount a year because of the harmful effects of them. So whenever you go through a cycle where you're doing them, and then they say, well, wait, you have to wait this many months because mm-hmm. it's damaging your joints.
I was going to say, over a period of time, does it hurt the tissue around the joint?
Absolutely. So it actually weakens the tissue, ligaments, tendons all around the area, so you're more susceptible to injuring it. So if it's like a knee steroid injection,
yes,
it can injure your meniscus, MCL, ACL, all that, and you can have those type of issues as well, not just the degeneration after you do these things.
So people think, well, I'll just get a steroid shot. You hear people say, I'll get a steroid shot, I'll be fine.
And some people will get quick relief, mm-hmm. but then it always comes back, right? It's a very temporary thing. You get quick relief. Some people get no relief. But in the end, you're left in a position where it's getting worse mm-hmm. and it stops working as long. So,
that's not something, fortunately, I'm not having those issues now, but that's not something I would want to deal with. What kind of patients do you and Dr. Bredemeyer see?
So we see all types. So I would say number one is somebody who is told they need a knee replacement or hip, shoulder, any joint really, fusion, mm-hmm. those type of deals, and they don't want to do it because they did their research and they know the dangers of doing that, and they want to avoid it. So there's complications that go with doing those surgeries, like blood clots that can lead to death, a lot of other things as well. So I always say this, why go to the most drastic measure before trying an alternative that could potentially have you avoiding that.
And that's one of the great things about Nexgenesis is and I love the word Genesis because it's like a new beginning.
Exactly.
Exactly.
We also see other patients that, maybe there's time for a knee replacement for them, or it's what their doctor told them, and they can't get it because they have heart issues, they're diabetics, they're high-risk patients.
Right.
So they don't even have an option to do a replacement. So we get patients like that that'll come in here, and we give them, hope that we can give them some relief.
What kind of symptoms do they normally present to you?
Yeah, so pretty much with every joint, whether it's knee or back or hips, they're going to present with achy joints, sharp pains at times, stiffness in the area, those type of deals. And it can affect their quality of life pretty drastically. If they like to go, walking on the beach or walking around the neighborhood, they might not be able to do that. Hanging around family or friends, different things that they enjoy.
Really
to do.
affects their lifestyle.
Oh yeah, fishing. I hear fishing a lot, hunting, those type of things. If you can't get in the stand, those type of deals. So, it really can affect you tremendously.
What is the process? If I was having issues with joints or whatever, what would be the process for me to come here to the clinic?
Yes. So first you call and you talk to Jessica. Okay, she'll get you scheduled. We'll do a consultation with myself and Dr. Breedemeyer. We'll each independently do our own exams. We'll do x-rays and whatever studies that may be necessary. It's on an individual basis on whatever that particular patient needs. Once we have everything we need, we go through it all and I make my advanced therapy care plan and he makes his procedural care plan, and then we go from there if they're a candidate for both.
Now, again, what they do, you can call your number on the screen. If you want some more information on it and find out exactly, and like you said, call Jessica, get it set up. Are you running any kind of special for those watching Shop South Mississippi?
We are. For your viewers, if you call and mention Shop South Mississippi with Jim Tabor, then we give you a $47 consultation exam that includes x-rays, any other studies that we may need to do in office. And we'll see if we can make you a candidate, see if you're a candidate, and we'll go from there.
Because not everybody is a candidate.
Not at all. Not at all. There's a lot of people that, unfortunately, if they're too far gone, they're too far gone. And we have to determine that in the consultation. Look, what we do, if you aren't a candidate, we give a refund on the exam because we want to help who we can help, right?
All right. Dr. Bourgeois, always a pleasure to talk to you.
Always a pleasure. Thank you.
If you'd like to get some relief, let me tell you what, this is the place to do it. Find out if you are a good candidate for it. Give them a call, located behind the Super Walmart on Three Rivers Road in Gulfport, Nexgenesis.